Most heart attacks don't begin with pain. They begin with silence. After 50, the heart rarely fails suddenly. It whispers for years, and we mistake that quiet for health. Heart attacks after 50 rarely announce themselves through dramatic obstruction. Instead, they emerge from a quieter biological instability that has been developing for years beneath the surface. Inside the arteries, cholesterol does not simply pile up like debris in a pipe. It behaves more like a biological response to injury. Over time, repeated exposure to inflammation, blood sugar fluctuations, oxidative stress, and hormonal shifts damages the delicate inner lining of blood vessels. This lining, known as the endothelium, normally keeps blood flowing smoothly, discouraging clot formation and regulating pressure with remarkable precision. As it weakens with age, it becomes more permeable, allowing cholesterol particles to slip beneath the surface and lodge themselves in the vessel wall. What forms is not a solid blockage, but a soft, unstable plaque, a living structure filled with inflammatory cells, fats, and fragile connective tissue. The danger lies not in size, but in temperament. Large, stable plaques often grow slowly and may never cause symptoms, while smaller, inflamed plaques are volatile. They respond aggressively to stress hormones, dehydration, sudden spikes in blood pressure, or abrupt physical exertion. A poor night's sleep, emotional shock, or even intense morning exercise after years of sedentary living can increase shear stress on arterial walls. When an unstable plaque ruptures, the body reacts instantly, attempting to seal the injury. Platelets rush in, clotting accelerates, and blood flow can be abruptly cut off. Not because the artery was already closed, but because the repair response became excessive. This explains why many people who experience heart attacks had normal test results months earlier. Standard cholesterol panels often miss inflammatory activity. Blood pressure readings taken at rest may not reflect vascular stiffness under stress. Fitness levels can mask endothelial dysfunction because strong muscles do not guarantee flexible arteries. After 50, the cardiovascular system becomes less forgiving of biological noise. The immune system grows more reactive, insulin sensitivity declines, and recovery mechanisms slow. The heart itself remains strong, but the environment it depends on becomes unpredictable. The tragedy is that this process unfolds silently. There is rarely pain while plaques form, rarely warning as inflammation simmers. The body adapts so gradually that abnormal becomes familiar. Mild fatigue is attributed to age. Subtle breathlessness is dismissed as deconditioning. Occasional chest tightness is blamed on digestion. Yet beneath these everyday explanations, blood vessels are negotiating a fragile balance between flow and rupture, stability and chaos, repair and overreaction, responding moment by moment to signals shaped by decades of living. Stress, exposure, metabolic strain, emotional suppression, and lifestyle rhythms that slowly teach the arteries how to behave under pressure. Looking healthy after 50 can be deeply misleading because outward strength often reflects muscular conditioning rather than the condition of the vascular system that sustains it. Muscles respond quickly to effort. They grow stronger, more efficient, and more visible with relatively short periods of training. Arteries, by contrast, change slowly and remember everything. They are shaped not only by movement, but by decades of blood sugar exposure, blood pressure fluctuations, inflammatory signals, sleep patterns, emotional stress, and hormonal shifts that quietly remodel their structure. A person may walk daily, maintain a stable weight, and appear energetic, yet still carry blood vessels that have lost their youthful elasticity and responsiveness. As arteries age, their walls gradually stiffen. The elastic fibers that once allowed them to expand and recoil with each heartbeat begin to fragment and are replaced by stiffer collagen. This process increases pulse pressure and forces the heart to work harder with every beat, even when resting heart rate looks normal. The change is subtle and rarely felt, but it alters how blood flows, especially during stress or exertion. A fit body can compensate for this stiffness for years, masking the underlying vulnerability. The legs may feel strong on a walk. The lungs may keep up, but the vessels delivering oxygen are operating under rising strain. There is also a metabolic illusion at play. Some individuals maintain normal cholesterol levels and body weight while harboring insulin resistance beneath the surface. After 50, muscle mass declines unless actively preserved, reducing the body's capacity to absorb glucose efficiently. Blood sugar may spike higher and stay elevated longer after meals, quietly damaging the endothelium without producing obvious symptoms. This damage does not announce itself through pain or weakness. It simply reduces the vessel's ability to dilate, repair, and resist inflammation. Over time, this makes arteries more vulnerable to plaque instability, even in people who feel energetic and capable. Fitness itself can create false reassurance. Regular exercise improves cardiovascular performance, but it does not automatically reverse arterial aging if stress, poor sleep, dehydration, or chronic inflammation persist. High-intensity activity layered on top of inadequate recovery can even increase transient vascular stress in stiffened arteries. The heart responds powerfully to effort, but the vessels may lag behind, unable to adapt with the same flexibility they once had. This mismatch between a strong engine and aging fuel lines is where risk quietly accumulates. What makes this particularly deceptive is that medical language often reinforces the illusion. Being labeled active, nanobese, or within normal range creates psychological safety that discourages deeper inquiry. Yet, vascular health is less about appearance and more about behavior at the microscopic level. How cells respond to pressure, glucose, and inflammatory signals over time. After 50, true cardiovascular safety depends not on how healthy someone looks, but on how gently and consistently their arteries are treated in daily life, moment by moment, beat by beat. After 50, blood sugar swings, chronic stress, and poor sleep become powerful, yet underestimated forces that quietly strain the heart over time. Blood sugar no longer rises and falls with the same efficiency it once did. Insulin works more slowly. Muscles absorb glucose less readily, and even meals considered healthy can produce prolonged elevations. Each spike increases oxidative stress inside blood vessels, damaging the endothelial lining and making arteries more reactive and less adaptable. This damage does not cause immediate symptoms, but it alters how vessels respond to pressure and flow, increasing vulnerability during moments of stress or exertion. Chronic psychological stress adds another invisible burden. Persistent activation of stress hormones such as cortisol and adrenaline keeps heart rate elevated, raises blood pressure, and signals blood vessels to remain slightly constricted. When this state becomes habitual, the cardiovascular system loses its ability to fully relax. The heart is forced to work harder even at rest, and inflammatory signaling increases throughout the body. Over time, this constant vigilance accelerates vascular aging and destabilizes plaque structures within arterial walls. Poor sleep amplifies both metabolic and stress-related damage. Inadequate or fragmented sleep impairs glucose regulation the following day, heightens inflammatory responses, and reduces the body's capacity to repair vascular tissue. Night after night, this silent erosion compounds, teaching the heart to operate in a hostile internal environment where recovery is incomplete and resilience slowly diminishes. Prevention after 50 is less about dramatic interventions and more about restoring balance within the cardiovascular system. Extreme exercise routines, rigid diets, or fear-driven health behaviors often place additional stress on an already sensitive vascular environment. The heart does not benefit from being constantly pushed into survival mode. Instead, it thrives when blood vessels experience regular, gentle stimulation that improves flow without provoking excessive pressure or inflammation. Consistent movement, such as walking, light resistance training, and steady breathing patterns encourages the arteries to remain flexible and responsive, reinforcing calm rather than shock. Equally important is nervous system regulation. The cardiovascular system is tightly linked to emotional state, responding instantly to perceived threat or safety. Practices that promote parasympathetic activation, such as unhurried breathing, time outdoors, social connection, and adequate recovery, signal to blood vessels that constriction is no longer necessary. This reduces baseline blood pressure and inflammatory tone over time. Nutrition plays a similar role, not as a strict rule set, but as a stabilizing influence. Meals that support steady blood sugar and reduce oxidative stress help the endothelium repair itself rather than remain in defense mode. True prevention emerges when the body is no longer asked to compensate constantly. By lowering internal friction and supporting rhythmic recovery, the heart can operate efficiently without urgency, protected not by intensity, but by sustained physiological calm. After 50, the body communicates risk in quiet, easily ignored signals long before a crisis appears. The heart rarely sends dramatic warnings in advance. Instead, it speaks through subtle changes in tolerance, recovery, and rhythm. A slightly elevated resting heart rate, slower recovery after climbing stairs, or a sense of heaviness in the chest during emotional stress are often dismissed as normal aging. Yet these small shifts reflect how well the cardiovascular system is adapting to daily demands. They reveal whether blood vessels can dilate efficiently, whether oxygen delivery is smooth, and whether the nervous system can transition from effort to rest without resistance. Listening early requires curiosity rather than fear. Tracking trends over time, not isolated numbers, reveals patterns that matter. Blood pressure that rises disproportionately during stress. Waist circumference that increases despite stable weight, or persistent fatigue after ordinary activity all suggest growing metabolic and vascular strain. These are not emergencies, but invitations to adjust before damage accumulates. The body is remarkably forgiving when given timely support, but far less tolerant of prolonged neglect. Emergency-driven awareness arrives too late because it reacts to failure rather than imbalance. Early attention allows correction while systems are still adaptable. By responding to quiet signals with patience and consistency, the heart is protected through understanding rather than urgency. And longevity becomes a process of cooperation rather than rescue.